Hello, everyone, and good evening. I'm Lisa Ling. Welcome to this very special event. I am so thrilled to be back with Mary Center, an incredible organization I first learned about in 2018 when I interviewed one of their participants for my series. I truly was just so moved by the important work they do for the community. And tonight, I am so honored to host a remarkable roundtable conversation with two distinguished guests where we will explore the intersection of health and education, which are cornerstones at Mary Center. It's my pleasure to introduce our esteemed guest this evening, U.S. Health and Human Services Secretary Javier Becerra from my home state of California, and U.S. Department of Education Secretary Miguel Cardona. Secretaries, welcome. Thank you so much for being here. Secretary Becerra, would you like to share some remarks?
Lisa, thank you. First, I'm excited to join you and Secretary Cardona for this, what I consider a really important conversation. And I have to say, congratulations to a force of nature. Dr. Gomez, who's in her final year as president and CEO. Gosh, what can we say? Thank you for your vision, for your leadership. For 3 decades, leading Mary Center. Geez, how many thousands of people have you helped? How many people have you kept alive? How many people are thriving because of you? Organizations like the Mary Center hold a special place, at least in my heart, because I share a very similar story to many of the patients and the families that use Mary Center. 33 years ago, Mary Center was founded to help immigrant women fleeing violence and poverty in Central America. I'm the son of immigrants. My parents came to this country from Mexico to seek a better life and more hope. They worked hard. They do exactly like the families that go to the Mary Center, and they work very hard to make sure their kids have a brighter future. That's exactly why Mary Center does so many good things for families across the DC metro area. And that's why HHS and the Department of Education are trying to do the same for millions across the country. So I am thrilled that as a member of the Department of Health and Human Services, we're doing our part to work with the Mary Center to do better for families and for humanity, and hopefully leave a brighter and more hopeful future for everybody. So I'm glad to be with you.
Thank you, Secretary Becerra. Secretary Cardona, would you like to share a few words?
Sure. Thank you. Thank you for having us. Lisa, nice to be with you. Secretary Becerra, always great to be with you. And Mary Center, thank you for the work you do to lift families, lift our students. We share the same goal of improving the lives of the students we serve. And Maria, thank you for your years and decades of service to families and to the community. Your impact will be felt for generations to come. It's my honor to be here, especially at this time. We know the last 18 months has presented challenges for our families, uh, challenges that we could not even have predicted just 2 years ago. But we're here now, and we have an opportunity with President Biden and the entire administration to build that better and really reimagine what it means to recover from a pandemic, to make sure that our students have the health and education access that they need, not only to recover, but to thrive. We share that goal. And I'm honored to be here today to spend some time taking questions and really shaping what direction we're going to take at the Department of Education to make sure that all students, regardless of where they come from, have an opportunity to thrive in our school system and have access to health so that they can be successful. And we know post pandemic that we need to do more for the social and emotional well being of our students, and we're poised to do that together. Glad to be with you all. Thanks.
Thank you both for those moving words. So let's get started then. Now, we all know that Mary Center is a federally qualified health center in the DC area. And for 33 years, they've worked to improve the social economic mobility for their community through their unique social change model, providing healthcare, education, and social services to community members. The organization has shown that health and education outcomes are inextricably linked. So I want to ask both of you, how do funding and programs from your departments work together and overlap to help all kids succeed? Secretary Becerra?
Lisa, at the Department of Health and Human Services and across, quite honestly, the Biden administration, we believe that in order to build back better, we need to support our families, our children, and our early education workforce as much as possible. Healthcare centers are vital to the administration's commitment to ensuring the health of children in the age of COVID. So we really rely on our healthcare centers. They are the primary care medical home for some 8 million children and provide care through more than 3,100 school based sites. The health centers have administered nearly 500,000 COVID vaccines to kids somewhere between the age of 12 to 18, and they've conducted some 2,500 vaccination events at clinics located on schools with using mobile vans, and we also now use what are called pop-up clinics. And in early September, we awarded approximately $5 million to some 27 health centers to expand services at new or existing health center program services delivery sites located at our schools. And so this funding will increase the number of patients who access our comprehensive primary healthcare services at these school-based center sites. And just last week, we awarded nearly $1 billion in funding to some 1,300 health centers across all 50 states, the District of Columbia, and the 5 U.S. territories. And that goes to help modernize the facilities and to support care, especially for underserved communities. Proud to be working with Secretary Cardona on these things. Our departments engage in a working group together to drive investments and outcomes in school-based health services. And through the Centers for Disease Control and Prevention, CDC, we will continue to provide public health guidance and the help that the Department of Education and schools across the country need. And that way they can make science-based decisions for their students.
It's great to hear about the synergy between your two departments. Secretary Cardona, would you like to respond to that? How does funding and programs from your department work to overlap to help all kids succeed?
It's critically important. I'll tell you, the $10 billion from HHS to support COVID testing in our schools is allowing schools to safely reopen. That's just an example of how we're working together, but we're going to continue to work together. You know, the health centers in our schools are critically important, not only to make sure our students are healthy, but to build confidence in our schools. And I'm confident that moving forward, we're going to have a stronger alignment between the local health centers and the schools because we serve the same families. In the American Rescue Plan, we provided $130 billion for safe school reopening. But that's just the beginning. This Build Back Better agenda provides funds not only for access to school, but access to community college, which maybe didn't exist for so many families. In fact, many families felt college was out of reach for them. It also provides good quality pre kindergarten programming for students ages 3 and 4 to make sure that they have a strong foundation in our schools. There's funds to also lower costs for Hispanic serving institutions and make sure that our dreamers also have access to these funds so they can continue their education. And the plan also provides economic stability for families as well. We know that healthcare costs, we know that childcare costs are really high, and provisions in this plan prevent so much of the salaries that people are making to go to childcare so that families can continue to thrive and grow. There's a big investment in our families in this agenda, and working together with Health and Human Services, I know our students, our families are going to be able to thrive much more post pandemic.
Well, thank you for that. I now want to move on to a very important topic, particularly in the last 18 months, and that is mental health. We all know that teenagers today are faced with so many challenges, from social and cultural issues to the dangers of gangs and drugs in schools. Nonetheless, 90% of public schools don't meet the standard of necessary counselors to support students. Now, Mary Center provides school based mental health therapy in 26 public schools and public charter schools in DC. And today we have a local teen here to express her concern about the issue. This is Tiffany's question.
Thank you for allowing me to be part of this conversation. I attend Trinity Washington University. Having mental health services available in school is so important in allowing students to stay focused and on track for graduation. Have there been a conversation between your two agencies to increase mental health services in schools and to encourage states to increase these services in all schools?
Thank you for the question, Tiffany. That's a great question. And I'll tell you, we just returned from a return to school road trip. And I talked to students at the high school level, at the college level, and they said the same thing you said. They said, we need more access to social emotional support and mental health supports. And as we reopen our schools, we need to make sure we're not just turning on the lights and ensuring it's a safe, physically safe environment, but also a an environment that nurtures a social and emotional well-being of our students. And I've seen examples across the country where it's happening. I saw in Michigan where a high school put in for all students in the high school a block of time to make sure students had access to social emotional supports. I saw in another place where hundreds of school counselors were being hired to support students. We have to make sure we do better than the ratios of school counselors to students that we have now. The American Rescue Plan funds are there for that. And in the Build Back Better agenda, there's over $1 billion to make sure we're doubling the workforce that is supporting the social emotional well-being of our students. In our return to school roadmap, we highlight three major areas. Number one, a physically safe environment. Number two, an environment that supports social and emotional well-being. And number three, academic recovery. We know the importance of social emotional well-being, and we're committed to really reshaping how we're talking about schooling to make sure we're taking care of the holistic needs of our students, and working closely with HHS on this path forward will make sure that we're taking into account the health needs of our students.
And Secretary Becerra, can you respond to Tiffany's question about increasing mental health services?
Tiffany, first, thank you for asking that question because it is us front of mind for so many people. And Secretary Cardona and I are making sure that our teams are working hard together on this one because we know that because of COVID-19, young people and students have suffered dramatically, and we're not waiting to act when it comes to supporting behavioral health needs. At the Department of Health and Human Services, we've invested hundreds of millions of dollars to provide resources and increase access to mental health services for vulnerable groups, including children and youth. In August of this year, as our nation prepared to start the new school year, we announced nearly $85 million in funding for mental health awareness, training, and treatment. $10.5 million of that funding went to expand pediatric mental health care access by integrating what we now know works really well, telehealth services, into pediatric care. And the remaining 74 million plus dollars was made available through two grants that raise awareness of mental health issues for youth, to train school personnel, and to coordinate treatment for young people who have emotional disorders. In addition to that, we have released nearly $1 billion through the mental health block grant program and about $4.5 billion in substance use block grants to states throughout the nation. This is the largest investment ever made in these two programs. And we've committed more than $80 million in this fiscal year to Project Aware. This is a program that helps build and expand state and local governments' coordination to increase awareness of mental health issues among school-aged youth. Back in May, I established a behavioral health coordinating council within HHS for one simple reason, so we could act and to help our communities overcome this behavioral health crisis. And within its prioritized framework, it has a specific focus on youth behavioral health. We're committed to continuing to support the social, the emotional, the physical health of our nation's youth. And so, Tiffany, your question is right on the mark.
As the mother of grade school children, it is so heartening to hear both of you speaking so passionately about the importance of mental health services and maintaining one's mental health. So, thank you for that. So let's now pivot to adult education. We all know that after high school, youth who do not pursue post secondary education have fewer opportunities available to them, which we know can translate to poor overall health outcomes. Now, quality adult education programs can support these individuals in improving their social economic mobility, and Mary Center addresses the needs of immigrant families together with their educational partner, Bria Public Charter School, through a two-generation education program. For example, through Mary Center's Child Development Associates program, they have helped over 100 people open their own child care development centers, with some of these students continuing their education to become teachers. Mary Center also has a medical assistant program to train people for careers in that well-paying healthcare field. So, what innovative ideas have you thought about that would help advance adult education and vocational training? Secretary Cardona, I'll start with you.
Thank you. And I love hearing what Mary Center is doing because it's really connecting folks there that are looking for more skills to help themselves in the employment sector. You're doing great work. You're doing great work. Adult education powers economic mobility for adults without a high school credential. It puts them on a pathway for further learning and jobs that pay family sustaining wages. And we know there's much more we need to do. As we think about building back better, we cannot go back to what it was like before March of 2020. I would love to see with the funds that are available, $675 million in fiscal year 2021. I would love to see, as we think about new ways of engaging, we cast a wider net to make sure we're getting more adults, many of them who, after the pandemic, want to restart and want to get more skills. So let's make sure that our vocational centers are open full time. Second shift. I always said having a second shift for vocational high schools for the adults in the community that want to get more skills. That's an option. Let's listen to our stakeholders. What are they looking for? How could we best support the parents who are working multiple jobs to make their family, support their family? How could we serve them? We need to make sure we're listening to our stakeholders and giving them the pathways that they need in a manner that's conducive to their life. A total of 1,719 local providers, including community colleges, local education agencies, and nonprofit organizations, served 1.1 million adults without a high school equivalency during the 2019-2020 program year. But 1.1 million is not enough. We must do better. And I know we can do better. So the goal is to wide a bigger net, get more adults, do it in a manner that works for them by listening to them, and make sure we give them the skills that they need to continue to thrive for not only themselves, but their families.
Absolutely. Secretary Becerra, can you comment on adult education and vocational training?
Absolutely. Well, it's clear we need to invest more in our nation's students to strengthen the public health workforce in order to meet the needs of our country. And what we're doing at HHS is working to expand talent with an eye towards promoting diversity and equity. Back in June, we announced that we had established an $80 million public health informatics and technology workforce development program. A lot of language to simply say we're going to try to strengthen and diversify our country's public health information technology professionals. We have a lot of folks in IT. We have a lot of folks in healthcare. We don't have enough diversity in either one. 2 weeks ago, the Office of the National Coordinator for Health Information Technology awarded $73 million as part of this program in cooperative agreements. The awardees of the funding comprise historically Black colleges and universities, HBCUs, and Hispanic serving institutions, HSIs, Asian American and Native American Pacific Islander serving institutions, and other minority serving institutions. So the institutions that have done the greatest job in recruiting and teaching our next generation of professionals are the folks that are getting this money. Collectively, they'll train some 4,000 individuals over a 4-year period through an interdisciplinary program to try to make health information technology more available and more a part of the talent and the workforce opportunities for folks of color. It'll help develop curricula, it'll recruit and train participants, and it will also provide for the ability to secure paid internship opportunities and to help these folks move forward in their career placement. In addition, I should mention in June, our HRSA office, and HRSA stands for Health Resources and Services Administration, we announced a $22 million award to 56 recipients as part of our Behavioral Health Workforce and Education Training Program for professionals. This is a program that aims to increase the supply of behavioral health professionals while also improving the distribution of a quality behavioral health workforce, and thereby hopefully what we'll do is increase access to behavioral health services to a lot of communities that have often been left behind. And a special focus is placed on knowledge and understanding of children, adolescents, and transitional aged youth at risk for behavioral health disorders. We'll continue to make those kinds of investments to develop the talent and to try to promote diversity and equity as we try to expand the healthcare workforce. That's the job here at HHS that we have.
We have now arrived at the final question of the evening, and this one comes from two young sisters whose family immigrated to DC. Let's hear from Edenia and Milen.
Hi, I'm Adenya. I'm 11 years old and in the 6th grade.
Hi, I'm Milan. I'm 8 years old and I'm in 3rd grade.
Right now, I'm interested in history, reading, and soccer. I've been in the student council for 2 years, helped in bake sales, and tutored to help support my school.
I'm interested in art, reading, and democracy. This year, I'm running for student council.
As we go back to the classroom, what are you both and the president doing to make sure we can keep learning safely in person with our friends?
Thank you.
Thank you.
Sure. Well, Adenia and Milen, I'm so glad, number one, that you're back in school in person, but I'm also glad that you have an interest in leadership in the student council. Thank you for not only trying your best, but also making your school a better place. And I love your question because it reminds me how important it is to make sure that our students have an opportunity to learn in the classroom with their friends and with their teachers. And I love the question, and I love the fact that you're working so hard. Continue to study, keep on doing those extracurricular activities. What we're doing at the Department of Education is number one, making sure we're supporting states and local districts in enforcing the mitigation strategies that we know work. That's just fancy for saying making sure students are wearing their masks, making sure when they're eligible for vaccinations, we're promoting vaccines for our students so that they can be safe, and making sure that our educators are vaccinated so we can make sure that they're safe. We know after the last 18 months, Adenia and Milen, that you want to be back in the classroom. You've put up with enough of the remote learning. So we have to do everything to make sure that you're safe and that your schools are even better places than they were before so that you can take advantage of all the opportunities that our schools provide. So what we're doing, communicating how to keep our schools safe, promoting those best practices, and most importantly, listening to our students who are telling us they want to be back in the classroom. That's where you belong. Thank you for the question.
Again, as the mother of two grade school kids, it's been pretty incredible to see how accustomed my kids and their friends are to wearing masks. I mean, of course, we don't want to continue having to wear them in perpetuity, but it's really not the kids who seem to have the issue with complying with mask orders. It's the parents. And so, Secretary Becerra, talk to us about how we can keep kids safer and maintain that level of safety in school in response to Adenia and Milen's question.
And Lisa, I have to agree with you. Sometimes it's the adults who are acting like kids, while the kids are acting like adults. And certainly in this case, Adenia and Milen are acting like adults. And I am inspired and I'm impressed by not only their interest, but the fact that they are now showing themselves to be leaders moving forward by asking these great questions. I applaud the leadership you've demonstrated in student council and your passion for community and public service. Quite honestly, I think you give a lot of us hope that it's going to be a bright future moving forward, pandemic or no pandemic. And ensuring that you can return safely to school and stay in the classroom, that's a top priority. You heard Secretary Cardona say it, you're going to hear me say it, and you certainly have heard President Biden say it. The truth is that we need to get you back in school full time, all the time, not a question. And we must do so in a way that is safe for you, for your teachers, for your staff, and when you go home, for your families. And so, as I've referenced before, CDC, the Centers for Disease Control and Prevention, has provided pretty strong guidance to schools like yours on what you need to do, the strategies you must adopt to prevent the spread of COVID. It has recommended universal indoor masking for all teachers, for staff, students, and visitors, regardless of whether you've been vaccinated or not. And CDC has recommended that schools should maintain at least 3 feet of physical distance between students within classrooms to reduce the chance of transmission. If we're able to follow that guidance and follow it well, closely, and if we use recommended and layered prevention measures correctly and consistently, uh, no doubt we're going to reduce the risk of COVID infections in our schools. And we know, by the way, that these measures work. Findings from several studies, the research not only suggests that COVID transmission among students is relatively rare, but that we can actually help prevent it the more we implement these strategies that we can put in place and do it the right way. And just last month, in a study from Los Angeles, Lisa, we showed that the rates of COVID in children and adolescents were 3.4 times lower than the surrounding community when mitigation tools like the masking, the distancing were utilized. So it's clear vaccines and masks save lives. And we want your teachers and your fellow students at school to be safe and healthy so you can continue to enjoy your hobbies and pursue your dreams. To you and your fellow students, we hope that you'll help those adults who are acting like children act like you're acting like an adult.
That's right. The kids really are leading on this issue. Thank you for that. This has been such an inspiring conversation, Secretaries Becerra and Cardona. But this is all the time we have for tonight. We so appreciate you taking the time. It's so important to recognize how interconnected health and education really are. A special thank you to Tiffany, Adenia, and Milen for your insightful questions. And once again, Secretary Becerra and Secretary Cardona, thank you so much for participating. We hope everyone here has a wonderful evening, and please wear your masks and stay safe.
Thank you.
Thank you.